COVID-19 started, we really didn't know what to expect. We didn't know what the impact would be to the community, to the clinic, or to the hospital. I think we're far enough into it now. We understand we're not going to be overwhelmed by this. What we did identify with this infectious process is that the healthy people elected to stay home, which initially was the right move. We're now to the point where we're starting to see patients with chronic diseases start coming into the hospital because they haven't had follow-up. We've taken some extra steps in the clinic to assure safety, mainly that being what we call the Respiratory Clinic. Anybody that has any COVID infections or symptoms is getting put into the Respiratory Clinic, which is a separate area in the clinic. So we're keeping those away completely from the healthy patient population. When we deem somebody needs to go through the Respiratory Clinic, we give them a phone number. When they arrive, they park in a certain place. Then they call into the Respiratory Clinic and someone comes out and gets them. Currently in the clinic and for the foreseeable future, all patients will be masked. All nurses and providers will be masked. And you'll find that in the hospital as well. That's just an extra layer of precaution. Again, all patients that are showing any signs of infection or that we know have COVID-19 are going to the Respiratory Clinic. With the processes we put in place for the safety for our patients, it's better for them to get back into their doctors now to get their chronic disease managed, to prevent them from going into the hospital with exacerbations. The ones we're really concerned about are the heart failure patients, the COPD patients, the chronic diabetics, hypertension, heart disease. For the most part, these patients have canceled their routine follow-ups and are planning to get in at a later date. The longer we go between routine visits, the more complications we see with these diseases. And so it's important that we get the word back out that it's safe for the patients to come back in and they get reestablished with their doctors and get back into a normal routine so we can prevent them from having complications from their chronic diseases. We will have COVID-19 with us for the foreseeable future, and we'll continue to take steps to assure safety for our patients, both in the clinic and the hospital side. But the chronic diseases don't stop because of COVID-19, and so we continue to have to make sure that we take care of our patients so that we can prevent those readmissions and make sure that the entire population stays healthy.